Hi there, my name is Diana Becker, and I am a registered nurse who is applying for the emergency nurse educator position with NRSNG. And I am doing a video really quick to promote myself for the application process. I'm going to do my 2-minute video on the triage process. And just keep in mind that this is a fairly rudimentary presentation for me. I usually am really diligent about making sure that I have appropriate citations and everything related to my pictures and my resources. Today, though, because I did just put this together for the application process, I did just drop in my footnotes where my pictures came from, and they were all just pulled off of Google. So not the best resources, but I am usually really diligent about doing that. Let me just straighten out my screen here for you. Okay. So we're going to talk a little bit about triage. And what I want you to keep in mind is looking at this picture, it's an image from the Boston Marathon bombing in 2013. And when you look at this picture, I want you to think about the fact that somebody has to go through and decide all of these people that are affected by this incident, who needs to be treated first, and who can go ahead and wait, or who needs to be rushed to the hospital right away, and who can go ahead and wait and be taken by private vehicle versus by ambulance or anything like that. Really, that's what triage is all about, is we're deciding which patients need to be seen first and which patients can wait to be seen until a little bit later. So triage comes from the French word for sorting. And so that's really what we can think about us doing, is that we are sorting our patients by their level of acuity. We do want to remember that triage is based on severity, not on arrival time of patients. So the patient who comes in and has complaints of difficulty breathing and has circumoral cyanosis and a low SpO2 level is going to be seen before the patient who comes in with a sore throat and is concerned that they have strep throat, regardless of if the patient with strep throat came in to the emergency department first or second. So triage systems can be used in or out of the hospital, and there's a lot of different systems available. The tag on the right is an example of a pre-hospital tagging system or a mass casualty tagging system that's frequently used. But lots of different systems are available, and as with anything in nursing practice, we do want to make sure that whatever we're using is evidence-based. So just as you're going out into practice, make sure that you are aware of what type of support the system has that your facility is using. The goal of triage is to prioritize patients and promote safe patient care. The bottom line is triage does help us to get our patients to see the doctor faster, because let's be honest, wonderful as nurses are, patients don't come to the hospital as a general rule to see the nurses. They come to see the doctors so that they can get treated. In a hospital setting, triage allows for each patient to be greeted by an experienced nurse. Very rarely do nurses without little experience or without a fair amount of experience start out in the triage role. Most hospitals have some sort of a process for introducing you into the triage position. This allows for rapid identification of patients who need immediate attention. The sorting leads to improved patient flow and decreased length of stay times. That's what LOS is there on the slide, is length of stay times. Accurate triaging decreases under triaging, which is important because we don't want to miss those patients that do need more acute resources in the emergency department, and it decreases over triaging, which helps to facilitate streamlining of patients and gets them seen faster, improving that overall flow of the emergency department. One of the other things that's really important with triage that is sometimes overlooked is accurate triaging helps to describe and benchmark the overall acuity of a emergency department. This can be used for revenue determinations and as well as appropriately staffing for an emergency department. So just within that last couple of minutes, I've shown you just the importance of triage and just a really, really basic idea of what triaging is. So I hope you've enjoyed my video, and I look forward to having the opportunity to speak with you all about this position with NRSNG. It sounds like you guys are doing some really exciting things as far as nursing education goes and supporting students throughout their schooling and into the first years of their career. I look forward to speaking with you soon. Thanks.